Joining us now, Dr. Ashish Jha, former White House COVID-19 response coordinator under President Biden and the dean at Brown University School of Public Health. Doctor, great seeing you as always. What do you think of RFK Jr. potentially leading the Department of Health and Human Services?
Yeah, so good morning, Jose. Thanks for having me here. I'm disappointed by the choice. I think he's a particularly bad choice. Look, when I think back to the previous Trump administration, the folks that he had in leading positions, Scott Gottlieb, Alex Azar as HHS secretary, those were good choices. Maybe not the ones I would have made, but they were smart, thoughtful people who understood how our healthcare system worked. RFK Jr. has got a series of ideas that are, I think, very, very harmful to the health of all Americans and all Americans. It's not just about vaccines, right? The HHS secretary has enormous power over Medicare and the insurance and what's going to be covered and how it's going to be structured for seniors, for over Medicaid and how we're going to cover half the kids in America. For all of us on private health insurance, whether mammograms are going to be covered, colon cancer screening is going to be covered. These are all decisions that are going to roll up to him. So yes, very concerned about his really off-the-wall vaccine ideas, but his ideas are not rooted in evidence and scientific thinking. And that is what worries me about the health of the American people under his leadership.
You know, Doctor, I want your thoughts on this because, you know, at times the head of HHS has not been, as a matter of fact, I can't remember when the last time was that there was a doctor like yourself in charge of HHS, right? Yeah. I mean, we're looking at some have political experience, some, you know, current HHS, Javier Becerra, former member of Congress, but is the head of HHS that position more than a bureaucratic shepherd? And specifically on HHS, what are the responsibilities and the impact that the head of HHS has over this extraordinarily large gamut of different organizations? And you were just mentioning some of them.
Yeah, no, so first of all, the people who are criticizing RFK Jr. because he's not a doctor, I think that's a nonsense criticism. I can't think of a last time we really had an effective HHS secretary who was a doctor. You don't need to be a doctor. You don't want people making diagnoses and treatments as the HHS secretary, right? What you want is somebody who knows how to run a complex entity, but most importantly, you want somebody who is going to let the career experts at FDA make a decision on whether a drug should be approved or not. Let the career scientists at the CDC determine whether a vaccine is safe and effective, or the FDA decides that whether it should be broadly available or not. We have a lot of scientific agencies at NIH. What should we be funding? And what good secretaries have done is let the scientists make those decisions and then make sure that you have a coherent policy around it so it gets out to the American people. RFK Jr. comes in with very strongly held views. That's okay. But most of his ideas and views have been widely debunked. He really has ideas that have been proven over and over again to be false. And if he starts trying to influence how we do things, what kind of drugs get approved, whether we're going to offer certain cancer therapies or not, maybe he believes that drugs aren't going to be the answer to cancer therapies, and instead, cancer, we need to do something totally different. That's how he begins to reshape those agencies. That's really what worries me a lot. Look, some of his ideas around we need to have less processed food, those are good ones. But the question is, what's the process we're going to use to really understand and make policy decisions?
And you mentioned a few times on the issue of his questioning of vaccines and the scientific research behind them. What do you think that specific issue of vaccines could bring to HHS?
Yeah, so let's just talk about vaccines for a second. Vaccines, the way we approve vaccines is we have an advisory committee, CDC director ultimately makes a decision. Whether those vaccines are going to be covered by your insurance or not is decided by the Secretary of HHS. So if he decides that we're not going to cover vaccines through insurance, for all Americans, you may have vaccines available, you're going to be paying for it out of pocket, or you're going to be paying a lot more. These are going to be profound effects that he can have for everybody, not just for the small proportion of people, for instance, who might rely on a specific government program. Half the kids in America get their vaccines through the Children's Vaccine Program. That could get gutted or totally reshaped. And then we're going to have a lot of kids who will not have access to vaccines. So, you know, the bottom line is that his 20-year history of undermining confidence in vaccines makes all of us very concerned that on that issue alone, and of course all the other issues, he can do enormous damage as HHS secretary, and the harm will be felt by all Americans.
And this final point that he kind of brings up, which is that revolving door that exists between big pharma and government, HHS, and all of the subdivisions within it, that whole thing, which I don't know if it's true or there's perception of it, that there is a lot of handshaking and exchanging of professional courtesies and professional just the revolving door and the relationship between big pharma and government.
Yeah. Okay. So let's get specific on this. I mean, first of all, there is always that concern across all agencies, and we want to have very clear rules about that. When I left the Biden administration, I had very clear rules about how I could go back in and how I could interact with the government for a long period of time. Those rules are appropriate. The Biden administration actually put in a lot tougher rules, and I'm very open to it. I think it's a great idea. When I think about the career scientists at the FDA, people who decide, for instance, whether a cancer chemotherapy should be approved or not, most of those people have been at the FDA for 10, 15, 20 years. They're not allowed to take any money from pharma companies directly. And if the concern is that there's still too much influence, let's put in really strong safeguards on that. Let's make sure that the rules are buttoned up. Again, I think the Biden administration made a lot of progress on this. If he feels like we should go further, I'm okay with that. But forcing those scientists who've been at the FDA for 20 years out, who are they going to replace them with? Either non-scientists or probably people from pharma and other industries. So I actually worry that whatever his rhetoric, the result will actually be a much worsening of the scientific enterprise inside the government. And so agree, we've got to have very clear rules and walls on this. But the way he goes about it and the way he thinks about it and talks about it, I think will end up leaving us much worse off.
Yeah, and Doctor, I'm reminded that Tom Price, Trump's first HHS director, was a doctor.
Yeah.
Right. So, but there have been entire administrations where being a doctor is not.
Alex Azar was a very good HHS secretary. Yeah. Alex Azar was a very good HHS secretary. He wasn't. There are a lot of very good people who've done it without being a doctor.